What is plica syndrome of the knee, and what are the usual signs, symptoms, and treatments? I discuss those questions and why orthopedic surgeons tend to avoid surgery for this condition in this video. My name is Dr. David Geier, triple board certified orthopedic surgeon, sports medicine specialist, and anti-aging and regenerative medicine expert. I help you feel, look, and perform your best regardless of age or injury. This video is part of my Ask the Doctor video series based on questions you've left me in the comments to the videos on my channel. Here's the question I received from a viewer. Doctors seem to be against surgery for plica syndrome, but I've had this surgery because the shot and physical therapy didn't work. I'm so much better, I'm never going to be back to pain-free or perfect, but the surgery works better than anything else. Why don't surgeons like to do it? All right, first of all, quick disclaimer, this is not meant for medical advice. I'm not telling you to get plica surgery, not telling you to avoid it. This is none of that. No medical advice at all. Like all of my videos, I'm just giving you information for educational purposes only. Please talk to your doctor or orthopedic surgeon. First of all, let's talk about plica syndrome. You don't see it on this model, but in a whole lot of the population, in 5, 10, maybe 20, 25% of the population, there's a small band of tissue, usually on the inside of the knee, inside the knee, that with range of motion, you go back and forth, you get a snapping sensation and this uncomfortable pain. And it a lot of times sort of goes away with time. A lot of people, those plicas eventually go away, not just the snapping from them. A huge percentage of the population has a plica. If you MRI everybody, or if you scope a lot of people, you will see them all the time. And the vast majority of those people have no symptoms at all, which is one of the reasons that orthopedic surgeons typically avoid scoping the knee and taking out the plica for knee pain. Now, if it becomes inflamed and does start to cause a snapping sensation on the inside of the knee with range of motion, then in theory, orthopedic surgeons might try things to calm it down, maybe anti-inflammatory shots, sometimes trying to get just a small amount of steroid injected into that plica to calm it down as things to try before surgery. And then in very rare occasions, then go in there and arthroscopically and take the plica out if nothing else is working, like it sounds like that was the case in this viewer. Sometimes if an orthopedic surgeon goes in surgically for, say, a meniscus repair or something, meniscus tear, trimming the meniscus out or something like that, and they see a big thick plica, they will resect it while they're there. I never typically like to do that because the swelling after removing a plica tended to be fairly significant, and it caused more trouble than it was worth. And again, that plica was very likely not the source. The reason orthopedic surgeons typically don't do it, surgery for that, is, again, they're so common, and very often that doesn't turn out to be the source of pain. And so, yeah, getting an MRI looking for a meniscus tear or some other source of pain may help figure out what that is, and then you treat that. Going in surgically, not really knowing what the cause is, you find a plica and excise it, doesn't typically do that well historically. The best candidates are one that definitely the pain is coming from the plica. Nothing else shows up on MRI. You can localize the pain right to where that is on physical exam. Sometimes you can feel the snapping back and forth. None of the non-surgical treatment options work. Then I think that can be a reasonable option. But again, it's just not something that we do that much anymore. Back in the day, early in the time of arthroscopy, in the 1980s, early 1990s, we did surgery for this. This was before my time. All the time for that. That has really come down significantly just because it's just not the source of pain very often. Now, I've written an ebook called The Arthritis Solution, where I talk about all different types of treatments for arthritis, not just surgery and cortisone. You can get it free by clicking the link in the description below this video. If you have an injury and you want to talk about options other than surgery or cortisone shots, you can also click that link in the description under this video, fill out the contact form to learn more about scheduling an appointment with me. I'd also love to hear about your injury. You can leave those in the comments below. Just know if you leave a question in those comments, I can't give you medical advice, but I might answer your question in a future video. Make sure to subscribe to this channel, click the bell to be notified when I release a new video and when I start my Ask Dr. Geier live shows. Thanks for watching, and I look forward to helping you feel, look, and perform better than ever.